Always don the PPEs before encountering the patient you intend to work with. Begin with the gown. Gowns come in a variety of forms, so some may have a few extra procedures such as picking out the proper size. But for the purpose of this video, we're using a one-size-fits-all gown. Begin by gently unfolding the gown in front of you and holding it horizontal from your shoulders so that it doesn't drag on the floor. If the gown touches surfaces around you, it could become contaminated, so limit the objects that it comes in contact with as much as possible. Make sure that the ties are on the outside of the gown as you pull it on. The opening should be on the posterior section of the body and not the anterior section. First secure the hair if necessary, and then tie the strap behind the neck in a bow, tight enough so that the gown is snug but not restricting the airways. Then pull the rest of the gown snug before tying the second tie on the gown to ensure that the clothing is not exposed in the back. This limits getting contaminants on your skin or on your clothing. Next, put on the respirator. Carefully raise the face mask over the face and cuff the ear strings over the ears. Pinch the metal nose bridge to secure the face mask over the bridge of your nose. Then pull the mask over your chin. The mask should stretch from the bridge of your nose to the bottom of your chin. Put on the goggles next. This is simple, just simply slide them over the eyes and secure the ear strap behind the ears. Next, put on the gloves. Gloves allow you to touch surfaces without contaminating objects. Pick gloves that fit your hands correctly. The gloves should not be too loose or too tight. You begin by sliding your hands into the gloves and pulling the ends of your gloves over the cuffs of your gown. Between donning and doffing the PPEs, remember that everything you touch could be contaminated, so you could be spreading contaminants to other surfaces. Therefore, don't touch your face. Touch only what you have to and limit contact with your skin. Touching the face could spread contaminants to it, and the same holds true for touching the hair. If your gloves are ripped, immediately remove them and perform hand hygiene before donning new gloves. When removing the gloves, pull the outside of the glove with your opposite hand, totally removing the glove from your hand. Then slide your ungloved hand under the gloved hand to remove the other glove. When removing the goggles, simply pull them forward by the ear straps and place them in a safe area. When removing the gown, begin with the lower strap, unfastening it so that the strings fold forward, and then moving on to the top section of the gown and untying the ties there. Hold on to them as you slide your arms out of it and make sure to only touch the back. The front side is considered contaminated, so make sure that you don't touch it as you roll the gown and throw it away in the trash bin closest to you. Next, remove the mask. The face mask is used to protect the face from germs. It's easily removed by simply taking the ear straps and pulling them away from the face.